Today, let's talk immunology, and specifically, let's start off with the immune system. Your immune system is your body's overall defense against foreign invaders like viruses, bacteria. It includes a lot of our organs, a lot of our glands. Think your spleen, think your adenoids, your lymph nodes. So it's this complex network that's all working together to keep us nice and healthy. And a normal functioning immune system should be functioning there at the top in the green. We've got actual threats like viruses, these kind of external things, and then we've got our immune response to these foreign particles, as bacteria, as viruses. Then down below and around in that beige, got these abnormal responses, like an autoimmune responses, wherein your body is fighting itself. It's going after your own function, your own healthy tissues, your own cells. You've got these exaggerated responses, like our exaggerated allergy responses, and all the way down into anaphylaxis. Then we've got an ineffective immune system. We've got this kind of subfunction of our immune system. So we're failing to recognize, we're failing to respond to these foreign particles, these bacteria, these viruses. We can see that in cancers and effects of other diseases as well. And when talking immune system, of course, we've got to talk lymphocytes, we've got T cells, we've got B cells, and these are just kind of the two major kind of fundamental cells of our immune system, and coordinating attacks against these foreign particles. So your B cells, your B cell lymphocytes, are going to be your memory cells. These are going to be producing your antibodies as they recognize a foreign particle. They'll produce these antibodies, create these memory B cells, and making up our immunity. T cells make up our cell-mediated immunity. They do not produce antibodies and respond only to specific organisms and parties. So we've got three types. We've got cytotoxic helper T cells and regulatory T cells, and each T cell has its own job to do. And again, they are not producing antibodies. They will not produce memory like the B cells will. And when producing antibodies, there are 5 categories that we want to highlight as varieties of our antibodies: IgA, D, E, G, and M. IgG is going to be our most common antibody found in our immune system. And then we are particularly interested in IgE, which not only binds to certain antigens, but is the cause of our allergic reactions. So if you ever hear IgE-mediated allergic reaction or IgE-mediated anaphylaxis, this is what's going to bind to our basophils and our mast cells, create that over-release of histamine, and set allergic reactions into motion. And when we develop immunity, it'll come in two major flavors: active immunity and passive immunity. But the end result is going to be, whether active or passive, is going to be immunity in a response to a foreign particle, bacteria, virus, when it invades our body. When our body has a foreign invader, we can help along with medication. So let's start with antibiotics. We have a number of different classifications of antibiotics. One of the larger classifications are beta-lactam antibiotics. These are our penicillins, our carbapenems, our cephalosporins, medications like amoxicillin, vancomycin, and bacitracin. How beta-lactam antibiotics work is they go in and inhibit bacterial cell wall synthesis, and they are bactericidal, so they go in and kill the bacteria altogether. And instead of weakening it, they just go in, kill it by inhibiting the synthesis of the bacterial cell. And in our beta-lactam category are our penicillins. So they go from narrow spectrum to this extended spectrum. So penicillin G and V, your original penicillins are in the narrow spectrum, and then amoxicillin, ampicillin is in the extended spectrum. We also have things like nafcillin and other cillins, which are penicillinase resistant. One of the ways bacteria fight against penicillin is by producing penicillinase, which deactivates penicillin, right? So if we have a penicillinase resistant medication, we are fighting the defense that the bacteria are defending with to overcome it. Bacteria may also produce beta-lactamase to fend off against beta-lactam medications. So we've got some medications that are kind of a combination, penicillins with another type of antibiotic, and these are these beta-lactamase inhibitors. So again, fighting the defense from the bacteria that's fighting off our, you know the deal. These a couple common ones in this category, you may have heard of Augmentin and also Zosyn. Then another category are our cephalosporins. So again, we're still under those beta-lactams as a broad umbrella, but our cephalosporins, and they've got newer. We've got first gen up to fourth gen now. Our fourth generation had these really great resistance to that beta-lactamase as being produced by these drug-resistant bacteria. But our first generations, you may have heard of Ancef, it's first gen, moving up through third generation like Rocephin. So as we grow in generation, advance in generation, the resistance to beta-lactamase gets greater. And we have vancomycin, and vancomycin works by blocking new cell wall units, so the building of the bacterial cell wall, and degrades bacteria that way. It's only used for gram-positive bacteria, and it is first-line, front-line treatment for MRSA, for methicillin-resistant bacteria. And then finally, we will mention our macrolide antibiotics. These are commonly prescribed for respiratory infections, for pneumonias. They go after the bacteria's ribosomes and attack that way. You may have heard of a Z-Pak. So Zithromax or Z-Pak or azithromycin is one of the common macrolides. You go into your doctor with a respiratory infection, you're probably walking out of the office with a Z-Pak. Okay, let's chat allergic reactions. There are different types of allergic reactions. We are, as paramedics, typically called out for the allergic type of allergic medications, the allergic hypersensitivity reaction, those IgE-mediated reactions. That give us our classic signs of allergy, could progress into anaphylactic shock, but we also have a few other hypersensitivity type reactions, including these delayed reactions and these immune complex reactions. In our IgE-mediated reactions, we see an allergen come in, right, and binds to IgE, surface of these mast cells and these basophils. Right? So when that happens, we get this release of histamine, this overrelease, an overrelease of histamine, causing inflammation and then leading to our signs of allergic reaction. And if that allergic reaction continues and the cycle and that process grows out of control, we go into anaphylaxis. So we've got that histamine release, and then that'll turn into bronchospasms, turn into vasodilation. Your vasculature becomes more permeable. We've got a little bit of third spacing and leakage, and that will lead into anaphylactic shock, this type of distributive shock. And talking histamine, we've got this abnormal release of histamine. You do have endogenous histamine in your body circulating all the time, but we've got this over-release of histamine now from our mast cells, from our basophils, this IgE-mediated reaction. So when that IgE binds to the mast cell, causes that breakdown, that degranulation, and has this excessive release of histamine. That histamine is then going to bind to histamine receptors, and there are a couple we need to be aware of. First is H1 receptor, primarily found in our skin mucous membranes. They give us some of our common telltale signs of allergic reaction, and then in large amounts, large activation of H1, large amounts of histamine can trigger and lead into anaphylactic shock. Because when we activate H1 receptors, we get all those telltale classic signs of allergic reaction. We get redness, we get little bumps, maybe little hives, we get some bronchoconstriction, we get a little inflammation. We also get GI muscle contraction, so we have GI effects. So someone's complaining of some GI symptoms. Always have it on your differential list, an allergic reaction, right? A specific type of allergic reaction. And we can counter these H1 stimulation effects by giving H1 receptor antagonist medications. These are our antihistamines and come in a couple flavors. There's first generation, there's a second generation. The primary difference between the two, other than the second gen being newer than the first gen, the first generation antihistamines cross the blood-brain barrier, while the second generations do not. So that means the common side effects of first gen antihistamines is sedation, sleepiness, because it crosses the blood-brain barrier. Those second gens do not cross the barrier, so taking a second generation antihistamine will not make you drowsy, will not make you sleepy. Some of our first generation antihistamines you already know, like diphenhydramine, Benadryl. You may have heard of meclizine or promethazine. Those are all first generation antihistamines and cross the blood-brain barrier, so they have those pretty heavy sedative effects. They also have some anticholinergic effects, so we have to watch out for those in cases of overdose. Your second generation antihistamine drugs, again, you probably have heard of things like Claritins or Tecalegra. These do not cross the blood-brain barrier, so have close to zero, very low to zero sedative effects, and those anticholinergic effects are also blunted. And then we also have H2 receptors. So your H2 receptors primarily found in that GI tract. That's why you might have some GI symptoms along with that histamine release. We've got H2 receptors. The main effect here when we stimulate H2 receptors is an increase in gastric acid. And if you have an increase in gastric acid, you might call that acid reflux, or it might be diagnosed with GERD, right? This reflux disease. So H2 receptor antagonist medications that we can get our hands on. You probably know of Pepcid or Zantac as famotidine. Some EMS agencies also carry famotidine as part of their allergic reaction protocol bundle. But so as paramedics, we can give famotidine IV, or you can run down to your local drugstore and grab a box off the shelf. As always, please let us know if you have any questions.